Using some old primary IV tubing, saline bag, and an extension, we're going to make a pushable IV line. This will be able to work with your standardized patients and with your mannequins as well. So what you're going to do is, this is the primary tubing that we use for the Alaris PC pump 8015. Just get some of that. It just keeps on going, all 108 centimeters of it. What you're going to do is, at the spike part, you're just going to cut right through that flexible tubing. EMT shears, they are wonderful. Cut and remove that, get rid of that. So this won't fit the tubing just yet. Get yourself a Swiss Army knife or an awl, something to enlarge that hole and biggen it. Just twist right in there, and that expands that hole, reams it. And we'll take some of the plastic right off. Good. Now at the, sorry, my bag's getting caught here. At the part that goes into the pump, this is what registers in the channel. There's this hard plastic part here that's got just a tapered tip. The tapered tip is hard. You can't cut that with your shears. Or I guess you can if you're strong enough. But as soon as it hits the flexible, you just cut that, get rid of the rest, and now this tapered tip is going to go into that reamed hole. Just like so. Sorry, that was out of view. You just push it right on in there. And now what you have is the spike goes down to the tubing. You have a control area to it. And now you have a part where you can connect to a clave. You can connect a lure lock to your clave and then push fluids. Now if you do that right now, if you're to hook this up to a bag, it's just going to spray every which way. So what I do is I take an extension, connect the extension to the lure lock at the bottom, and then make sure that lure lock is locked off. So now when you push a fluid, it's going to hit here and then just back up into your spike. And that drains into an old IV bag. So now this part can be hidden underneath your mannequin or your standardized patient. They can put it on a little lanyard, wear it underneath their patient gown. And then this part can get tegadermed or affixed to your patient. I take an IV, I cut off the catheter and just connect the hub, and then when I tape it on, tegaderm it on, it looks like we have an IV placed into that patient's arm. Another little hot tip for you here, because we try and reuse everything that we can. We have these plastic golf tees. They are the Evolution Pro Length. These are long and plastic, and they can replug your IV bags, which just lets us reuse them. But at some point in time, the plastic just gets a little worn. So, anyway, I've now got another set. Fluid is going to drain into this bag. I have a method of controlling rate if necessary. I have a clave that we can lure lock onto. Of course, I wipe this off using a nice clean technique. And then I have an extension that's locked off and an IV hub. Give that a nice little push, and my fluid just back primes into the bag.